Two of the more common problems that I treat include sciatica as well as mechanical low back pain. First, I want to go through a little bit about the anatomy of the lumbar spine. This is your low back. So just to orient you, if I turn it sideways, this is someone's belly, and this is someone's low back. These white structures are vertebrae. They're the bones in your low back. These little gelatinous structures here in between are discs. These little yellow structures are nerves. Those are called nerve roots, and they're throughout your entire spine, but in your lumbar spine, these are the nerves that come out of your spine. They come out of these little holes called foramen. In your low back, you have small little joints here, and they go all the way up your spine. These little joints are called facet joints. That's the anatomy of the spine. Now, when we speak about spinal conditions, some common ones. One of them is sciatica. Sciatica is a painful condition where people feel that nerve pain down either one leg or both legs. If I see a young person, maybe in their 20s, 30s, 40s, 50s, and they come in with debilitating nerve pain, numbness and tingling down their leg, the number one reason for that is a disc herniation. That disc is most likely pressing up against one of the nerves in the low back, causing this debilitating pain down their leg. So that originates from these little structures, as I mentioned earlier. These are the discs. And here's an example of a disc herniation. Think of these discs like jelly donuts. What can happen with a disc herniation is that the gel inside that disc herniates out. It pops out, just like a weakness in a wheel where you get an air bubble. So there are many ways to treat individuals who have sciatica from, for example, a disc herniation. One way is medications. Often patients can get better with simple non-steroidal anti-inflammatory medications or a brief course of oral steroids. Other patients might get better from physical therapy. Other patients might need more interventions such as an epidural injection, which is a cortisone shot that I deliver in the spine while using an X-ray machine called a fluoroscope. There are a few types of epidural injections that can be done. One of the more common types of epidurals I do is called a transforaminal epidural. What does that mean? That's where I put a needle inside this canal right here. If you recall earlier when we were talking about the anatomy of the spine, I called this little hole here the neuroforamen, where this nerve comes out. By placing a needle right up here in this canal, I'm able to lather up this nerve root, and I'm also able to get some of the cortisone into the epidural space. That cortisone is a very strong anti-inflammatory medication. What it does is it neutralizes a lot of the chemical irritants that come from this disc herniation. Patients often get sciatica not just from nerve compression where this disc is hitting up against this nerve, but also that gel that we talked about releases a lot of chemical irritants that cause inflammation. By delivering some cortisone directly to the source, we're able to alleviate patients of that severe and debilitating nerve pain. When patients come in to see me with sciatica, I would say well over 90% of those patients can get better with an epidural injection and hopefully avoid surgery. Another common reason that patients have sciatica is from what's called spinal stenosis. Spinal stenosis simply means that the spine is narrowing. That's what stenosis means. Where does that narrowing happen? Well, it can happen in these canals. We mentioned earlier that these are called neuroforamen. You can see this canal is pretty big. It can accommodate this nerve. But as we get older, through arthritis, these joints, these facet joints get a little bit bigger. The space between the vertebrae gets more narrow. And what happens is these nerves can get squeezed because the canal is too narrow. There's also a central canal here in the middle where your spinal cord is, this middle canal also can get very narrow, and it can cause the nerves to get squeezed, causing that severe and debilitating pain down the legs. For these conditions, I also perform epidural injections once patients have failed conservative care, either through medications or physical therapy. These epidural injections can be quite effective in reducing the pain that patients have with spinal stenosis. A second common problem that I see among my patients who have low back pain is what I call mechanical back pain. Mechanical back pain is pain with movement, and that can come from an irritation of several structures in the lumbar spine. Earlier, when I talked about the anatomy, I talked about these little joints here in the lumbar spine. These are called facet joints. These joints become arthritic as we get older. No one is spared. And what happens is these joints, just like an arthritic knee, can become quite painful. For patients that have mechanical back pain from these joints, there's a procedure that can be done called radiofrequency ablation, where I can put a needle along the path of the nerves that supply these joints. And what I can do is I can burn those nerves or ablate those nerves, where we can stop the transmission of pain from these joints to your brain. Radiofrequency ablation has been with us for many years. It actually originated in the cardiac care centers where patients had arrhythmias from nodes in their heart. And what cardiologists found is that they can ablate those nodes so that they're no longer sending signals that shouldn't be going in the heart. We use that same technology in dealing with painful spinal conditions, where we can now ablate the nerves that go to these painful joints so that patients can live pain-free. The type of patients that have this pain include the weekend golfer, the young athlete, or patients with scoliosis, or just patients generally who are getting older who have mechanical back pain or that stiff pain, particularly with standing and walking or twisting. For patients with those conditions, we have something more to offer than just physical therapy or medications, but we have this very easy and safe intervention that can help patients live without medications or narcotics and be able to golf and walk freely and hopefully without pain.